You're listening to Weird Medicine with Dr. Steve on the Riotcast Network, riotcast.com.
I need some suction. In the carotid.
I've got diphtheria crushing my esophagus. I've got Ebola vibes dripping from my nose. I've got the leprosy of the heart valves, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, my wife, Tacie. Hello, Tacie.
Hello, Steve.
She's the Queen of Maine, right? The Vicar of Liquor. I don't even know what that means.
Obviously not anything good.
Who, unlike Lady Diagnosis, will do nothing for a battle of expensive wine, but will still demand it nonetheless.
Is it 4:30 yet?
This is a show for people who had never listened to a medical show on the radio or the internet. If you got a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy, or go to our merchandise store at cafepress.com/weirdmedicine. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, clinical laboratory scientist, registered dietitian, or whatever. All right, very good. Please don't forget to check out feals.com/fluid, feals.com, that's feals.com/fluid, for 50% off your first order if you order a subscription of premium CBD products. Check out stuff.drsteve.com, stuff.drsteve.com. Takes you to a page that has every product we've ever talked about on this show, plus just please click through the link at the top to take you to Amazon. Anytime you go to Amazon, just use stuff.drsteve.com. Really helps keep our show on the air. And then tweakedaudio.com, a Tennessee company who has the best earbuds for the price on the market and the best customer service anywhere. And I'm not even kidding about that. Use offer code FLUID for 33% off your order. FLUID, F-L-U-I-D. And then if you want to lose weight and get to your ideal body weight with me, go to Noom, Noom.drsteve.com. It's not a diet, it's a psychology app. It helped me in my regular life, and not only just my eating life, but it changed my relationship with food. And even though I'm cooped up in the house and I'm cooking more and I'm eating more, I'm maintaining...
Cookies. He's cooking cookies for me.
I'm maintaining my weight. Well, I never cooked any before.
I'm just getting fatter.
Maintaining my weight. You're quite delightful, honey. You're in no way, well, anyway. Mm-hmm. And then if you want archives of this show, it's just a losing. No matter what I say, I'm just going to be getting in trouble.
That's right.
I find you to be quite delightful.
Thank you.
That way. I'm putting a link on our website where you can get archives of our show. For $30, you get a 32 gig thumb drive and 17 gigs of shows that goes all the way back to the beginning. And those are available at drsteve.com. And don't forget Dr. Scott's website at simplyherbals.net. And if you're a recent listener, you're going, who? I'm starting to wonder. I don't even remember what he looks like.
Oh, my gosh, we haven't seen him in forever.
I know. Well,
I hope he's okay.
He's not to be trusted with COVID-19. That's why. No.
Oh.
No, he's kept his office going, and me too, and it just, we're both exposed to things, so it's just smart for us to stay apart from each other for a while, but we'll have him back someday. He can come in as a guest, but you're sitting in his seat now.
Well, temporarily.
Okay. We'll see about that. Well, how are you?
Oh, I'm sorry. I was texting. I mean, it's not even started. I'm not paying attention. I'm fine.
That's the story of my life. It's fine. I'm used to it. Don't worry.
It's
I don't
just
blame
fine.
you.
Everything's fine.
Yeah.
Everything's fine. I'm lonely now.
Oh.
I've gotten to
Well,
that
you and Lady
loneliness.
Diagnosis, she's feeling the same way.
Yeah, it's just hard, and there's nowhere, you can't go out anywhere. I mean, we've got a little hot spot here, so
Yep. You're right. It's there are some parts of the country where they're able to do stuff. My COVID sit rep last week, which, by the way, if you're interested in looking at that, you can go to YouTube and just search Laugh Button. And we're on the Laugh Button channel, and they have a playlist of just SARS-CoV-2 COVID-19 situation reports. We do statistics and do some other things like that. And the last couple of weeks, I've been doing an in-depth look. Like 2 weeks ago, we did in-depth look at the remdesivir trial. This week, we did an in-depth look at the Moderna trial, and I also revealed where Moderna got its name. Did you know where they got their name?
of course I didn't.
You fooled me for a second. It's from Mode RNA. They were Mode RNA Therapeutics, and you mush that together, and you get Moderna out of it. That fascinating?
That's fascinating.
I can see you're fascinated. Who are you texting?
Okay. So I have a customer who is texting me.
Okay.
And so I feel like I need to respond back.
Yeah, I know. It's just timing. It's like when you want to do something, then all of a sudden there's, everybody wants to talk to you.
I am excited to be here, though.
Yeah. Me too. We skipped last week.
Yeah.
We just decided to take a damn week off.
We just didn't feel like it. I'm sorry.
Oops.
Didn't feel like it. Oopsie.
A bill.
Uh-oh.
So, no, that's good. I don't care about the F word. We're trying to be a little bit more circumspect, partially because I'm going to be slightly less anonymous, I guess, going forward, but we'll see about that. And just stay tuned on that. And anyway, but yeah, you look good, though. I'd rather look good than feel good.
Oh, I do not look good, Stephen.
I
You're
think
just
you do.
saying
I
that.
think you look very juicy and delightful.
Thank you. That's my goal,
All right.
juicy.
And delightful. All right, you want to answer some questions?
Yeah, let's answer some questions.
Give yourself a bill.
Oops, wrong thing. Thanks, Hope.
Number one thing, don't take advice from some asshole on the radio.
That's exactly
I didn't
right.
prepare anything because
No, that's fine.
I'm not your puppet anymore.
Nope, you are not. Never were, but you played the part for a couple of weeks, and I
Yeah,
appreciated it.
Thank you.
I do want you all to check out the...
Hello, Tacey's husband.
Oh,
Hey, got a quick question for you. How large molecularly is this coronavirus
very small.
molecule? I know it's a dumbass question.
No, it's
But
not.
The reason I asked,
No, it's not a dumb question. As a molecule, I mean, compare it to, say, methane or something, it's huge. And we could actually look up the molecular weight of the outer coat, I guess. But as far as a thing in this world, it's exceedingly small. I mean, you can see bacteria under a microscope. You need an electron microscope to see viruses, all right? So orders of
now
magnitude
you're seeing
smaller.
people wearing bandanas as face masks. Okay, a bandana is only a single layer of fabric, and it's not a very high thread count, so
Or maybe 2 layers, but yeah, I get your point.
it looks like it's very porous. Is it fine enough to actually stop a coronavirus
Ooh, I'd love
molecule
this.
That's
from
a
getting
good
into
question.
your system, or is it just more psychological and people want to run around and dress up like cowboys? Let me know. Thank you.
That's, by the way, Stacy DeLoach, everyone, lest I not say his name.
Oh, yes.
Stacy DeLoach, we speak your name. Oh, wait, I bet I could do it this way. Hang on. Can you tell I'm a little bit punchy? Stacy DeLoach, we speak your name. You like that? No, she's texting again. Anyway, he's absolutely right. If people coughed up viruses, then these things would be worthless. In fact, however, what those things are designed to stop are not viruses, but droplets. We're coughing up droplets that have viruses in them. And the droplets, yes, are large enough that the mesh can stop them. There were a couple of studies done where they had someone with SARS-CoV-2 cough into a petri dish or into some viral collection medium with a mask on and without the mask on, and watched the difference, and there was a decrease in the number of viral particles. So anything that'll decrease the number of viral particles that you're exposing somebody to is a good thing. When there were just, 10 or 100 cases in the United States, then it was dumb for people to wear a mask. Now that there's, what's the number today, Tace? Do you know? Let's look.
The number of coronavirus.
Yeah, cases in the United States.
No, I do not know.
Okay. And then now my mouse isn't working, but it's lots. Now, so let's say it's 1% of the population, or 1/300th of the population. You got a million, couple million. If we had 2 million cases that we know about, then that would be 1/150th of the population, right? Still
Yes.
less than 1%. Then you would have more of a reason to wear face masks when you're trying to prevent transmission, especially in areas where this has become pandemic or endemic, where it's where high concentrations of people is what I'm trying to say. So those people, if you're in New York or another place where there are hot spots, you should be wearing masks. If you're symptomatic, you should be staying home, but there are asymptomatic carriers as well. It's just you're showing when I see somebody wearing a mask, says I care about other people. You're not wearing the mask to keep from getting it. You're washing your hands to keep from getting it. You're not sticking your stupid fingers in your mouth and nose, which I don't think I've done for 3 months now. If I have a big-ass booger in my nose, I'm going to use simply saline to flush it out. I'm not going to stick my finger up there anymore.
Okay, good.
Is that good? Okay.
Yes.
I thought you would approve. So, yes, face masks would not stop a cloud of viruses, but they will stop droplets. Okay? There you go.
Hey, Dr. Steve, listened to you for years.
Hey,
Got
thanks,
me out
man.
of some jams before. Now,
Okay.
they tell me I have primary hemochromatosis, hereditary hemochromatosis.
Okay.
Could you let me know if you know anything about that?
Okay. Well,
I appreciate it.
Okay. Thank you. I do know something about it. So, hereditary hemochromatosis is a condition where people absorb too much iron from the food that they eat, and so they get excess iron. And it's stored in the organs, like the liver and other sort of not tasty organs like pancreas and heart. And it can, if not treated properly, or if it's missed, it can result in liver disease and other problems like that, even diabetes, if the pancreas is infiltrated. So, this is an inherited problem. So if you have it, if you have kids, be good to do a genetic analysis. But even then, most people that have the gene don't develop severe disease. But people who have hemochromatosis can have joint pain, abdominal pain, fatigue, that kind of stuff. Like I said, diabetes. And it can also cause problems like impotence and liver failure, and it can turn your skin bronze. They get like this bronze diabetes, it's called.
So how do they treat it?
Well, isn't that an interesting question? So you can treat it a couple of ways, but the easiest way to treat it is to just remove blood from your body. So you'll go in and they'll take a pint of blood every once in a while when your iron stores get to a certain level.
Can you donate that blood?
No, they can't be donated. They could donate it for maybe research purposes. But they may have a pint of blood taken once a week, and then after that, they'll, once the iron levels are back to normal, then they'll do it, whenever it's needed, usually every couple of months or something like that.
When symptoms flare, or
Yeah. Or well, if you're waiting till symptoms flare, you probably waited too long. So in this case, they would do blood tests
okay.
to try to take care of it before you get symptomatic. Because if you're symptomatic, you've got end organ damage for the most part, All right. Now, taking blood out won't reduce or improve cirrhosis. So you want to get on this before you get cirrhosis. So people will who skip their physical exams, and don't get their yearly blood work, they may miss this. So,
Okay.
It's another reason to do it. They do screen for these kind of things. All right.
What would that show under? Just iron? I hate that word. I can't say it.
Iron.
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 Arn.
Just ARN. If you're from Tennessee, you can get away with saying ARN.
Arn.
Yeah. Well, the thing is that a lot of people don't have any problems other than elevated levels of iron in their blood. So they may have some other, elevated, like liver function tests or something like that, or joint pain with an elevated liver function test, and then they'll check your iron. It's not like polycythemia. Those people have too many red blood cells, and that's pretty easy to diagnose in just screening stuff. But the way that they diagnose this is with a blood test called a transferrin or a serum ferritin, and they're just blood tests that are abnormal in this disease.
Okay.
Okay, so there you go. Anyway, ARN. Say ARN. ARN.
Arn.
ARN. There, you're from Tennessee. You can get away with it. The correct pronunciation is iron.
Iron.
You're mad at me, which is often. You have ire, and then just put an N at the end.
Iron.
Iron. There you go. All right?
Okay.
You're listening to Weird Medicine.
And though you will try to always get it right, the beauty of life lives inside of you. And I hope someday you find it too.
Tacie, do you experience stress
No.
or have anxiety
Oh, absolutely never.
or chronic pain?
Do you know what drives me crazy are those people who will put on like Facebook, oh, now I know anxiety's real. Oh, are you kidding me?
Yeah, really.
I mean, what the hell? Where have you been?
Have you never had a kid? Because if you have a kid, you know what anxiety
No, these are
is.
people with children. I mean,
Yeah.
are they just floating through life? Like,
Yeah.
oh, anyway.
Well, if you're having any of those things or having trouble sleeping at least once a week, you're not alone. Many of us do, and personally, I have difficulty sleeping sometimes, but I have this myalgic disorder called polymyalgia rheumatica that causes my muscles to ache, and it makes it difficult for me to sleep, and I just feel crummy. And I was searching for something that would help, and then I discovered Feals, F-E-A-L-S. Feals is premium CBD delivered directly to your doorstep. And what does it do? It naturally helps reduce stress, anxiety, pain, and sleeplessness. And it certainly helped my chronic pain. I really can tell the difference if I don't take it. Now that's just me. That's an anecdotal report for me. It works
helps me
for me
too, Steve. It really helps, especially to calm me down at night.
Yeah.
It really does.
So you just place a few drops of Feals, that's F-E-A-L-S, under your tongue. Feel the difference within minutes. The thing to remember about CBD is finding your right dose is important, and everyone's dose is different. So leave room to experiment over the course of a week or so. You may need to take more or less to get the effects you're after. Are you new to CBD? Feals offers a free CBD hotline to help guide your personal experience. Who's doing that? No one. Well, Feals is. They're the only ones that I'm aware of. Feals works naturally to help you feel better, and there's no high, there's no hangover, there's no addiction. Join the Feals community to get Feals delivered to your door every month. You'll save money on every order, and you can pause or cancel anytime. Feals has me feeling my best every day, and it can help you too. Become a member today by going to feals.com/fluid. That's F-L-U-I-D, and you'll get a 50% off deal for your first order with free shipping. That's feals.com/fluid to become a member and get 50% automatically taken off your first order with free shipping. feals.com/fluid.
You're listening to Weird Medicine.
Hey, Dr. Steve. This is Albert from Albuquerque again. I hope you're still doing well.
Hey, thanks, man. We're doing
Great
okay.
to hear. Hey, listen, I was really glad that you answered my questions. I do have one follow-up. I called about the calcium score, and you said there's a possibility that there could be a false negative. Understood.
Okay, so we're talking about a calcium score for cardiac risk screening. So in people that have at least one risk factor, like high blood pressure, high cholesterol, early family history of heart disease, they can pay $50 most places, between 50 and 150, to get a calcium score done, and they do it in off cycles of, in a CT scan suite. And then they can tell you, they give you this number, and low numbers are better. If you have a score of 0, which if I remember this guy did, you have a very perceived low risk of having myocardial infarction in the next 10 years. However, I did say that you could have a false negative if you had a plaque that hadn't been calcified yet, that kind of stuff. So that's what he's talking about.
I'm just curious, that I should probably plan on again next year just to do a follow-up. It's not much money, and see if anything changes from the baseline. In that period of time, you said it could be some soft plaque that hasn't formed yet.
Right.
Just curious about that. So I'd like to hear a little more about that, and be listening for your show. Oh, by the way,
that's you.
I love hearing Tacie on the show. She's a great compliment to the show.
Well, you just
love
missed
her
the compliment.
I'm familiar with that area. I fish there.
Hang on.
Be listening for your show. Oh, by the way, absolutely love hearing Tacie on the show. She's a great compliment to the show.
Yay.
Oh, nice.
Love her personality. I'm familiar with that area. I fish there in the Watauga every year, and miss that area of the country. But
All right, buddy. Well, if you're ever in our area, come say howdy do.
Yeah.
We'll put you on the air.
Watauga's beautiful.
Yep.
So, could people hear that phone call?
They couldn't hear the phone call. They could hear the ringtone.
That's what I was asking.
Yeah.
That's great. That's
Yeah.
the same person I just said to call me at 3:30.
And
so
they just called you
obviously-
now.
Yeah.
Is it some doctor who has the hots for you?
Of course it is.
I know it. God damn these
Probably
these
a nurse.
doctors. Well, she might have. He or she may have the hots for you too. So this guy wants to know if he should get a calcium score next year because I put doubt in his mind when I said you could have a false negative. Remember, no test is perfect. There's always a chance of having a false negative with any test or a false positive. And pre-test probability is the key for these things. Is you don't want to do a calcium score on a 10-year-old kid because even if it's positive or negative, it doesn't really tell you anything because the odds that they're going to have coronary artery disease almost zero just by definition. So you want to choose your population appropriately, which is why we do these on people that have at least one risk factor. Now, yes, it is possible that he has a false negative. It is unlikely. And there was a study that was done that looked at exactly what he's asking. So I'll give him one of these.
Give yourself a bill.
For asking a great question. That where they did a calcium score, then they repeated them, whether they were high risk or low risk. And what they found was repeating it at a more rapid interval than every 5 to 10 years in a low-risk patient did not reveal anything. They stayed low risk. And repeating it in a high-risk person didn't change anything because they stayed high risk. So there is no benefit to the aggregate population, the statistical population. Remember, statistics don't apply to the individual. There might be someone in that group that would have benefited. But in general, people don't benefit by repeating these things more than every 5 to 10 years. Okay?
Got it.
All right. Great question, though.
Hey, Dr. Steve. It's your old pal Keith from Florida.
Hey, Keith.
Now Keith from Los Angeles.
Oh.
Ooh.
Glad you're still doing the show, buddy.
Thanks, man.
Got a question. We always talk about how we kind of build immunity to everything around us by pure exposure.
Yep.
Like I know they speak about kids nowadays being more susceptible to nut allergies and that kind of stuff, and they say it's because parents are being hyper clean. They're not letting their kids roll around in the dirt and the mud and be just kids. So I'm wondering.
Yeah, I don't remember our kids ever eating mud pies and stuff like we did. We used to make pies out of mud and eat them.
Well, is that a good thing or
No,
a bad thing?
We'll talk about it.
That's disgusting.
But I mean, we never did that. Now, Beck ate dog food all the time.
He did do
Liam would yell, "Mom, Beck's eating dog food again." He'd be over there in the dog bowl just munching on dog kibbles. But anyway.
Because we're living in this new COVID world where everything is being wiped down and cleaned and hyper sterilized, are we putting ourselves at risk for other things besides COVID because we're not getting exposed to those things that we are wiping out with the COVID cleaning? Thanks, bud.
That's a cool question. I like it. There's a difference between adults and children, for one thing. So when he says "are we," I'm assuming he means adults. And there is a difference between doing this your whole life and doing it for a year or a year and a half or however long we're going to be dealing with this bullshit.
Oh, God, please don't say a year.
Well, let's
and
say 9 months.
I don't want to hear that either.
Okay, let's say 6 months.
Oh.
So March to, September. We won't have a vaccine by September, but we may have one by October. Pfizer is, keeps making noise that they think they may have a viable vaccine ready for market for the whole world by October. So I hope they're right. And so that wouldn't be so bad. That would be record time, by the way. And those people who do this deserve endless, oral treats for the rest of their life if they get an effective vaccine out by October for real. They should get oral treats the rest of their life for free.
Absolutely.
Just on demand.
And maybe just for a little while, shut up about Big Pharma, just for a little bit.
Ooh.
I said it.
You certainly did. And Big Pharma is going to be partnering with the military on this too, which is going to be really interesting.
Is they're going to get this vaccine, but then they're going to hold it back. See,
that's right.
That's what they're going to do,
and they're going to charge. Yeah, you're right. They've got the cure for it. They just ain't giving it because you can't make no money if everybody. Oh God, shut up. You haven't been here, but I've said this on this show before because we've heard the conspiracy that doctors have the cure for cancer.
Well, don't you know it?
And it's very simple, and we all know it, but we're not saying it because it's not good for business if we cured cancer. Now, if this were true, I would be the first to get on Fox News, CNN, MSNBC, and reveal the simple cure for cancer that everybody can do with over-the-counter ingredients just for the blowjobs that would come from
Why are we so concerned with oral treats, as you call them today?
It's just
all right,
it's a symbol
I understand.
Of,
I get it. I get it.
Salutations. Okay, just for the salutations. That doesn't sound as interesting. If I said, just for the pats on the back.
I might as well just say fuck continuously if you're going to talk about oral treats. I mean, seriously. Okay. We've just gone downhill. This is a terrible show. This is terrible.
Well, but this is one where we're actually taking a bunch of calls and doing good information. Though.
Okay, so let's keep
You want me to just
that.
bleep out all that stuff?
Yeah, maybe.
And I'll just...
No, you can... I don't know.
I'll take out where I said blowjobs and then put like a robot voice that just says... Salutations. Let me do that.
I would like that.
That would be funny.
Yeah. That would be a lot of work, it sounds like, though.
Oh, shit. No, I can't even do it right. Salutations. Okay. Yeah, I've lost mind. This is getting to me, actually. I think it is.
Well,
I'm just not as focused. I think all of this is getting to me.
No, it's everything is getting to me.
It's getting to everybody.
What's going on in our country?
Yep.
And
yeah. Well.
And then we got this virus that's going to get us all in the meantime.
It's not going to get us all, but it is affecting us all. But, I stand by the words that I said the very first time I spoke about it on the air, which was either Jim and Sam or Anthony's show or Opie's. It was one of the three. And I said, most people won't get it, and most people who do get it won't die. But you can see even that being true, and it's totally true. It has the capability of just effing us up big time, you know?
Well, yeah, and economically.
Well, that's what I mean, yeah.
Yeah, it's terrible.
And mentally.
Mentally.
Yeah. So where were we? Oh, the clean environment hypothesis. How did we get off so far afield?
Because you said oral treats.
Oh, that's what it was. Oh, yeah, because I was talking about the vaccine.
Yeah.
Yeah, sorry. Well, they should. They should get all the oral treats they want on demand. They should just be able to go up and say, okay, I demand my oral treats, and we just do it. Man, woman alike, right? Yeah, I think so. So a lot of parents...
I hope my boss never finds out about that.
I can bleep your part out.
Okay.
Or I can bleep my part out, too. But a lot of parents believe their children really should be kept in this sort of clean environment. And you're one of those. Because the idea of your kid eating a cow... Or not a cow patty, that would be disgusting. A mud pie horrifies you. But a lot of people... there is some research that says that unclean conditions are actually good for your immune system. And define good means that you've been exposed to more horrible things. But people who are kept in very clean environments from very young age have a higher rate of allergies and asthma and other things.
Well, they do say that homes with pets, are less likely to, kids are less likely to have allergies.
That's interesting. You have your iPad? You might look that up while I'm waxing eloquent on this. There was this Dr. Strachan, Strachan. He was an epidemiologist. And he wrote in the British Medical Journal that people in larger households had fewer instances of hay fever because they were, and his hypothesis was, they were exposed to germs by older siblings, viruses and other things like that, whooping cough and stuff. And that led to further research that suggested that a lack of early childhood exposure to less than pristine conditions can increase the individual's susceptibility to disease. What'd you find?
I found it. It's all over the place. But this article was from the New York Times, December 19th, 2018. More pets, fewer allergies. Children who live with cats and dogs when they are infants are less likely to develop allergies later in childhood.
Kind of makes sense.
And the more pets they have, the better.
Well.
A Swedish study of 1,278 children has found.
Wow.
Now, of course, we've got a farm. I mean, not literally a farm, but many, many animals, too many.
Yep.
And
kids still have allergies.
One of our kids, they're both just
shows
snotting.
That statistics don't apply to the individual. But there was this Erica von Mutius. Sounds like a Marvel villain. Dr. Mutius. Compared the rates of allergies, and I'm getting this from livescience.com, by the way, the rates of allergies and asthma in East Germany and West Germany, and they unified in 1999, as you remember. And the initial hypothesis was that East German children who grew up dirtier and generally less healthful conditions would have more allergies and suffer more from asthma than their Western counterparts. However, her research found the opposite. Children in the polluted areas of East Germany had lower allergic reactions and fewer cases of asthma than children in West Germany. It kind of makes sense that they're not seeing these allergens as foreign later on in their life. They're seeing them as part of the environment, and your body's basically got a mechanism by which it acclimates itself to its current environment. That's me saying that, not this article. So now, when we get to this COVID business, yes, the kids that are born now are being raised in really hyper clean environments for the most part, in the people who are not only wiping stuff down, but they're isolating themselves, so they're not being exposed to other kids and all that stuff. So when they go back to school, when this is all over, you're going to see a rash of viral illnesses that they're going to have to get caught up on.
Yeah.
And
just like a kid going to kindergarten.
That's right. And it's right. So it'll happen when they're in second and third grade, maybe, instead of kindergarten or whatever.
To adults as well?
Sure, if there are viruses that are circulating that are sort of low level that people aren't getting because they're not being transmitted at the rate, like Norwalk virus.
Oh, boy, that's a fun one.
Oh, you remember that?
Yes, I do.
How could you forget? You know, a 24-hour puke bug is one thing. You puke about 8 hours and you feel like shit for 24 hours. But the puking is usually about 8 hours, so usually at night for some reason, and you can sleep through some of it. And but that Norwalk virus, God, we were sick for a week.
Oh, it was terrible.
Can you imagine a whole cruise ship full of people like that?
No.
Ugh. So anyway, so yes, I don't think that this short period of time that we're doing this is causing any long-lasting damage. The kids will just get caught up on these allergens. There may be for some kids that were just born that are in this clean environment hypothesis situation, it may affect them adversely. But again, it's going to hopefully be a very short period of time. That's how we got off on it, because I said it's not going to be that long. Because I said it was going to be a year to a year and a half, and then I had to back it down to 6 months just to make you happy. So, don't worry about what the facts are. Just say 6 months.
Yeah. I hope the virus just wants to make me happy and goes away.
I know, me too. Me too, Tace. All right.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
Hi, Dr. Steve.
Hi.
I am a healthy 39-year-old. My heart rate is consistently at 100 or above.
Okay.
And my temperature is usually like 95 or 96.
Oh.
Is this something I should worry about, or is...
Okay. Yeah, go ahead.
I'm glad she brought this up. I
Yeah.
would like to talk about healthy heart rates as
Okay.
well.
Sure. Yeah, well, you're the fitness guru. You wax eloquent.
Okay, so
Tacie works out 4 or 5 times a week.
my heart rate runs mid-80s, and that seems high to me. Although I do have a thyroid condition.
Right.
And I've often thought, before I had the thyroid condition, my heart rate was not that high.
Yeah.
And I'm wondering if that is caused by it. And what about this lady with her heart rate that high? Is that...
So the normal resting heart rate for adults is between 60 to 100, with the lower considered more healthy. So lower heart rate, usually, unless it's pathologically low, generally indicates a healthy heart, more efficient heart function, better cardiovascular fitness. And, elite athletes can have a heart rate as low as 40 and still be normal.
I know. And so what about her? What about
Right.
me?
Right. So a lot of things can influence your heart rate, your fitness, your activity levels, and if you have a cardiovascular disease, or your body position, emotions, stress level. Stress. You are a high stress individual, my friend.
Yes.
Who I live with. And that alone can give you a high heart rate. So meditation and other stress-related things, doing the Trip app, TRIPP.com, if you have an Oculus Go or an Oculus Quest, may help to reduce your heart rate. And certain medications can cause it as well. She said she was normal, but her temperature is slightly low as well. Now, 98.6 sort of a myth. So mine is consistently 97.8. But to be at 95 is, it's a little on the low side. It could be, it's all a bell curve, and she could just be an outlier. 2 standard deviations away from the mean. But with a high heart rate and a low temperature, I would check her thyroid.
Yeah.
That'd be one thing I'd check. See if she has other symptoms that a simple blood test. I'd do a complete physical and why not just do a resting EKG and just make sure that is what we call a sinus rhythm. In other words, P, QRS, T wave. We talked about those a couple of shows ago. All of the elements of a normal EKG, so that you have atrial contraction and then ventricular contraction and then ventricular relaxation. All of those normal things. So if it's above 100 and it has those, we would call that sinus tachycardia. And sinus tachycardia can be a sign of disease, but also can be just a sign of somebody that's just incredibly out of shape too. But I'd look at all that stuff. Is it stress? Is it thyroid? Is there a blood pressure problem? Is there a medication problem? I'd look at whether she's on contraceptives.
Medications can really raise the heart rate?
Well, anything that can lower the blood pressure and cause the heart to have to compensatorily increase. Okay? So let's say you were on Hitrin. I'll just throw this one out for hyperhidrosis. Mm-hmm. Hitrin can lower blood pressure, and the heart sometimes, if it needs to pump more blood, will compensate by beating faster. So things like that. So we'll just, and any over-the-counter supplements, I would want to know all of those.
Okay.
Just to be complete.
Synthroid, though? No?
Yeah, Synthroid could do it.
Synthroid can increase
the heart rate? Yeah. Mm-hmm. Sure.
Cool.
Yep.
Okay.
So any of those types of things could do that. Now, the goal in you is you have low thyroid, right? Mm-hmm. You're taking Synthroid to bring your thyroid back to normal. That shouldn't have that effect, right? But if your body had acclimated itself to a very low thyroid for a while, then coming back to normal could cause you to have an elevated heart rate.
I mean, right now says 88.
Okay, that's not bad.
It's not good.
Now you do, how much aerobic stuff are you doing in your exercise? Because you're doing more power stuff, right?
Yeah, but when you lift weights like that, your heart rate does increase.
Of course.
But as far as cardiovascular, I'm not doing what I should do.
Yeah. So you're not doing the sort of aerobic thing that we would assume would bring your heart rate down.
Yeah.
Now, this woman, by the way, that's sitting across the table from me, you don't want to wrestle with her because she will beat you like a girl, even if you're a 65-year-old man. You're the strongest woman I've ever met in my life. And when I mean strong, I mean physically strong.
That's funny.
Mentally strong, no.
No.
But physically strong. It's unbelievable how strong you are. Because she works out with this guy, and I'm telling you, his guns the circumference of his arms is the same as my waist. I mean, they're huge. And he doesn't inject them with synthol. They're not artificial. Those are real muscles. The dude is amazing. You have nothing to say. I'm having a conversation with him.
I'm sorry. Well, no, he is. I mean,
fine.
he's pretty cool.
Yeah.
I like him pretty good. I've been going to him for a long, long time.
Yeah.
Like 8 or 9 years now.
So anyway, my advice to her is just go get checked out.
Go get checked out.
Yep.
Hi, it's me again.
Oh.
I am calling because
another girl.
I'm not very good at this. what am I supposed to do when you swallow a dirty penny?
Okay.
Oh, no.
Or I'm sitting here and my heart rate is 112.
Oh, that's the same person.
Yes.
Oh, okay. So let's just answer the other question that she asked. What happens if you're an adult and you swallow a dirty penny? Okay, I'd love to have her live on and ask how that happened specifically. But anyway, the answer is nothing. Dirty pennies are gross, but like H.G. Wells said, we earned our place in this world again, alongside our bacterial cousins, And there, for the most part, there's nothing pathologic that's living on a penny that's going to hurt you, that your stomach can't take care of. And then the passing of it, it's pretty incredible, but you can pass that through your small intestine and through your large intestine, usually without any problem, unless you had a stricture in your bowel, or, a scar tissue or something like that, or a kink in the bowel that was causing it not to pass. So the great thing about swallowing something like a penny, as far as knowing where it is it's very easy to identify on an X-ray. Because they're radiopaque, the X-rays can't go through. It shows up as a big white oval. Only would be a circle if it was presented exactly in the plane of the film.
Do you remember when our way too old child swallowed a quarter?
This is what I'm thinking of. He swallowed a quarter and turded it out with no problems whatsoever. And how old was he?
Way too old. I don't remember exactly.
7 or 8?
Yeah, way too old.
Why did he do that? Do you remember what the circumstance was?
Mm-mm.
He just had it in his mouth, I think, and was just swishing it around, and he swallowed
so
it. So they didn't eat cow pies or mud pies, but they did eat. Well, I grew up, on a farm. I grew up around cow pies. We used to throw them. The farther you could throw it, a matter of fact, when I lived in Vermont, they had cow pie throwing contests.
Mm-hmm.
They also had this fun contest where they would take an area, put a cow in it, and grid it off, and then you would pay money for grids, and wherever the cow would deposit fecal matter, that person would win. It was a sort of a lottery.
Cool.
Yeah. All right.
I got nothing to say about that.
No, me neither.
Hey, it's your dumb friend. Just not a medical question, but I just listened to 407, show 407, and you're talking about wanting to do a live show. Why couldn't you have one of Jim's or Sam's dumb producers there on Saturday night? You just feed it just like the Bennington show does, but where they've got Vito in the studio catching the phone calls and then
sure
putting up the post. Ron and Gail sit at their house and do everything over an ISP.
Sure. I mean, we would love to do that. We've been talking about it for 15 years, so I've just sort of given up on it ever happening. But the problem is there's no longer a Saturday Night Virus. And during the Saturday Night Virus, they had staff in the studio on Saturday nights. Now, for my pissant show, they're not going to, pay someone to be in the studio at 8 o'clock at night on a Saturday to do our dumb show live. That's what I've just figured out. Because, when we used to go up there those number of years, there was live shows going on Saturday nights, and there just aren't anymore. So I just don't see that happening. But that would be fun to do. I'd love to do a live show.
And we couldn't work out the capability here?
Yes, no, we have the capability.
Oh.
Yeah, we have it. I can control, it's pretty cool, Tace. I would have the screen here just like they do there. That's a web-based thing. It's not hardware-based. So I could control the phones from here. They would just need an engineer there that was answering the calls, doing the call screening, and then, routing them to us.
Another problem is that Saturday night is wine night, and I'm not sure I would be willing to forego that.
You wouldn't have to. They would all just be drunk shows. We've done a couple of drinking shows.
We have.
Ron and Fez, or Opie and Anthony used to do some drinking shows, and there was some drinking, especially when Eastside Dave McDonald was on during the Ron and Fez era, and there were drinking shows. And so, yeah, we would just do a drunk medical show every Saturday night. But we would love to do it. And that's how it would be done. Matter of fact, I think Jennifer Hutt's been doing it from her house way before COVID started. And there have been some other people that have just been doing their shows from their home using an ISDN line. But the internet lines have gotten so good, you can just about do it with an internet codec instead of an ISDN codec, but we could do both.
Well, that's interesting.
It is interesting, isn't it?
No.
Okay. Not
Hey,
whatsoever.
Dr. Steve, I had 2 root canals done on Tuesday. Called the dentist on Friday. I got some swelling in my face, and now it looks like I got fat lip. Is that an infection in the tooth, or is that what would your advice be, other than just to continue to take the antibiotics that are prescribed me? You're the man. We love you.
Hey, thanks, man. Likewise. A fat lip after a root canal. Well, you can get. Look, when they do a root canal, I know more about the root canal than I'm going to know about getting a fat lip afterward. Basically, what they do is they drill down into, a lot of these teeth will have a cap, a crown over them. But if they don't, they'll drill down into the tooth and expose the nerve in there. What they're really trying to do is you're taking a tooth that is chronically painful. You're just going to take the nerve out. And so they drill down in there, and you get this delightful laughing gas. And this is done by endodontists. And they remove the pulp, and then they replace it with this stuff called gutta percha. What it is, I don't know what the hell it is. But they replace everything in the tooth with this stuff, and then you go back to your regular physician or dentist, and then they put a crown back over it to cover it up. And it's really pretty cool procedure. It's one of the first sort of micro procedures, and it's when it works, it's great because you can preserve the use of that tooth for years afterward. You don't really need the nerves and all the stuff that's in the tooth. When you do this, of course, you're setting up a lot of inflammation, and inflammation can lead to swelling. But if you've got swelling in the lip, you should call the endodontist immediately and let them know, because swelling in the lip could denote swelling elsewhere. And what you wouldn't want is swelling in your upper airway, and that would be a problem. So just give them a call, let them know what's going on, and they'll talk to you about it. Honestly, the one thing they teach us nothing about in medical school is anything to do with dentistry. The only reason I know anything about a root canal is because I've had one myself. So they'll most likely recommend that you put cool compresses on the lip and all that stuff, but call them and ask them. I honestly have no idea. How about that? All right. You don't hear me say that too often, Tace.
No.
Yeah, Dr. Steve, this is Rob. I'm a big fan of your show.
Hey, thanks,
this
man.
isn't a medical question.
Okay.
But what is the give yourself a bill thing that you always play whenever somebody does something right? Just curious to what that is. I'm sure a lot of other people want to know, too.
Okay. Well, okay.
I would like to know.
Well, that's Opie. So it's give yourself a bell. He used to say, when somebody would say something right, he'd go, give yourself a bell, with this stupid voice, and then he'd hit the bell.
Give yourself a bill.
That's Opie.
That's Opie. So I stole that from them just for the old school Opie and Anthony listeners. But when I was on Anthony's show, I can use my soundboard, and because I'm doing it from here from the studio. So when he said something that was right, I gave him a good old...
Give yourself a bill.
And it was funny because it was the only time that Opie's ever been on Anthony's show, on his new show. So she's not listening again.
No.
It's okay.
Well, I was looking I was looking for that email from that person who worked for the airlines, I wanted to talk about that. It was very interesting.
Oh yeah, no,
but
take a minute to see if you can find that. His name was Dan. I remember that. So you could just search for Dan in your email, and we know 2 Dans, but he I'd love for you to read that. Let me take another question here.
Oh, don't expect me to pay attention.
It's okay. I won't. I don't know what you're doing.
Tacie, I was wondering.
Hey man.
Just presuming, I know no one really knows yet, but presuming that previous exposure to COVID-19 does not give you any sort of immunity at all, then what good would a vaccine be?
I think we answered this before, actually. First off, absence of evidence is not evidence of absence. Yes, no one can say that getting the disease, COVID-19, and recovering from it will give you long-lasting immunity to SARS-CoV-2. That's just because nobody's had it long enough yet. I mean, somebody got it in November. There was a few people that got it in November and December in China and stuff, and then it spread. So no one's had it 10 years to know whether you can get it again. And the people who have had these positive tests after having negative tests, that means nothing to me. I've not heard of a single person that tested positive after having 1 or 2 negatives that actually got sick or gave it to somebody else. So those people most likely just had false negative tests, and then they had a positive test. And we don't even know that if they had fully recovered and they were asymptomatic, what they may have been pulling out of their nose, if it was polymerase chain reaction testing, was just viral fragments that tested positive because they are the viral RNA. That's what they're looking at. So I am unconcerned about that right now. We'll see down the road. Now, if all of a sudden 2 years from now, people that got this and recovered are now in the hospital on the ventilator with the same damn virus, then that's cause for alarm. But there's really no reason to think right now that that's what's going to happen. Did you find that guy's email?
I did find the email.
Okay, you got 1:52.
Wanted to give you some basic information when it comes to airliners and how the pressurization and air conditioning work.
Okay, so this was about, you were talking about taking your plane ride.
Yes.
Yep.
The topic of recirculated air in the cabin seems to be a common topic in question with the ongoing pandemic. I'm a captain for a regional airline. We operate for American, United, and Delta with the Embraer 170/175 aircraft. In the case of our plane, the amount of recirculated air is only 40% of the total air in the cabin.
That's interesting.
The other 60% comes from the outside.
I had no idea.
Other airliners have about the same split of recirculated to fresh air in the cabin. The pressurization system works so well that it could explode the fuselage. In order to maintain a comfortable cabin altitude, the pressure that will ensure a long life for the airframe, there's an outflow valve that allows the high-pressure cabin air to exit the aircraft. In addition, the cabin air is filtered through HEPA filters. According to our maintenance team, the filters can get rid of 99% of the crap that can get you sick.
Including viruses.
Yes. In addition, we are currently operating many flights with passenger capacity at over 50%.
Yeah.
Our aircraft has a few rows of first class, single seats on one side and side by side on the other. We don't have the luxury of blocking middle seats, so plenty of people have someone next to them on a flight that's half full. It's a necessary evil for us to survive. We are having to operate fewer flights to save money until passenger numbers rebound. If the major airlines could furlough right now, they would lay off half their pilots and flight attendants.
Oh.
Regionals like mine would have to do the same. Even with operating fewer flights and limiting passenger numbers to maintain some form of social distance, we are all losing massive amounts of money each day.
Yeah, I bet.
And he says he's been checking this data from the TSA nearly every day. We've got a long way to go, but the numbers are slowly trending higher. It also goes to show how few flights there are when a total of 200,000 to 300,000 passengers can lead to aircraft being full. When I've seen social media posts or stories on television news of crowded planes, I just have to say these people that are complaining chose to travel by air. No airline is required, nor does it make financial sense to only load a plane where everyone has a seat open next to them.
Yeah.
I've operated a flight all month, and I'm taking all of June off. Compared to what they should be, the airports are basically ghost towns. Detroit this past Friday looked more like a slow Saturday in the dead of winter, not the Friday of the holiday weekend that kicks off summer. And then, of course, he says his wife and him love the show and podcasts. It's one of the primary things to listen to on his drive to and from the airport.
Well, isn't he a good fella?
Well, thank you. Thank you for,
thank you,
and I did rush to judgment. That was, it was my choice to fly, and I did get freaked out when people were sitting next to me. And
well, you weren't complaining. You were just freaked out.
It was a little freaky, but yeah, I appreciated
that's
him.
the way I took it anyway.
Yeah, exactly.
I mean, it's just a weird-ass time.
Yes, and they can't be flying planes half full.
No.
I mean, it does make sense, and they are losing a ton of money every day. And everybody's got to do what everybody has to do.
And we have to have an airline industry. We cannot have a country without an airline industry. We can't have a country without a postal service.
Yeah.
We can't have a country without restaurant workers. I mean, all of this, there's very few cogs. Radio hosts is one we can do without,
Yeah, my career is also one.
Yeah, that's true.
I'm unessential.
So, anyway, well, that's good. I'm glad he wrote in. And if any of you all have anything to say, feel free to write or call in. We're happy to. And
we actually read it.
Yeah. Because we ain't got nothing else to do, right?
Don't have nothing else to do.
Well, we can't forget old Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, thank you, Hope, Travis Teft, Lewis Johnson, Paul Ovcharski, Eric Nagel, Roland Campos, Sam Roberts, Pat Duffy, Dennis Falcone, Matt from the Syndicate, Ron Bennington, and Fez Watley, who supported this show, has never gone unappreciated. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 8 p.m. Eastern, Sunday at 5 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. And go to our website at drsteve.com for schedules and podcasts and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.
Goodbye, everyone.
Thanks, Tace.